Hi Mark, my name is Kristen and I'm a physical therapist. From the history you gave me, you are an avid cyclist and really been struggling with some anterior foot pain. Often cyclists expect the problems not to be right at their foot. Yours is a fairly common injury, and what I'm guessing, just based on the history without being able to feel and actually palpate and to physically examine your foot, you describe your pain to be right along here in the front of your foot, which I'm guessing it is the anterior tibialis tendon, and that's a common tendonitis to get. It comes up, runs along the side. It can present itself as shin splints, but you can also have this pain a little more distally along the foot. So you had mentioned that you have an ultrasound machine at home, and if that's the case, if you're in the clinic, I would ultrasound you, but I would use a pulsed setting. So if you can use a pulse setting at 20 to 50%, I would ultrasound the most sensitive area for about 6 minutes. Then I would utilize ice as much as possible. You've also been utilizing ibuprofen, which is very effective as an anti-inflammatory. Some of the other things I would do is I would do a cross-friction massage, would massage right over the tendon, back and forth over that tendon that is so sore and the tendon spots. I'd also follow the muscle all the way up, because you'll probably feel some tenderness up into here. The anterior tibialis dorsiflex and inverts your foot here, so you can see that it presents itself right here. And I would just go right down into the tendon and massage and massage and massage, followed by ice. I would ice 10 to 15 minutes, put the ice pack directly over it. Depending on how cold the ice pack is, you might want to put a layer of a thin towel under it to protect your skin. And ice for 10 to 15 minutes, 3 or 4 times a day, waiting at least an hour in between. So if you do your cross-friction massage, ice, do your cross-friction massage and ice, that should help really significantly reduce the inflammation. The other thing is to stretch your foot. You can just gently pull down this way and massage along as you stretch. But again, you want to feel just a gentle stretch, gentle massage in here. You don't want to irritate that tendon. The goal is to reduce the inflammation, because as the pain level comes down, you're going to significantly, as the inflammation comes down, you're going to significantly reduce your pain. The other things to protect your foot off the bike, you want to wear good supportive shoes. A sneaker. I would avoid things like flip-flops, open-toed, anything, or shoes that don't have a heel. I would wear a good supportive sneaker until this really calms down also. Because another cause of it is excessive pronation, where your foot falls. Another common contributing factor is tight Achilles. So you want to really get in and stretch your calf. Just doing the runner's stretch, stretching that Achilles with a straight leg and a bent knee will also be effective. So you want to wear good supportive shoes to protect this. Stretch out your calf. Control the inflammation here. And lastly, with cycling goes, the reason why I think sometimes long-distance cyclers get this is because you are clipped in, you're excessively pulling up with that foot. If you still need to train and want to really protect this area, I would go clipless for a few rides for a few weeks to get the inflammation to calm down. Then you can clip back in. I don't know how versatile your bike is or if you're able to accommodate that. But wearing good supportive shoes off the bike, reducing the inflammation, soft tissue massage all the way up the tendon, controlling the inflammation there. Also, if you had somebody that was skilled at kinesio tape, you could do a kinesio tape. I don't know if you've heard of that, but you could tape right along that tendon, and that would significantly help reduce the inflammation. So that's something you can order, or go to a local physical therapy practice and see if they have some kinesio tape, and you can try that. it's something that you could tape yourself with. So I hope that answers your question. If you have any further questions about this, please feel free to contact us. Be well.